Hi everybody, this is Dr. Nam Lee from Lee Acupuncture at the Newport Beach. And today I want to discuss about a very commonly asked question regarding what acupuncture and then what's our specific approach for healing at our clinic. And as you know, acupuncture is over 3,000 years old, Asian medicine still practicing worldwide and heavily practiced in the Asia for sure, but even United States, like early 1970, and the acupuncture was introduced in Western world. Acupuncture anatomy, so the let's say Eastern medicine anatomy and then Western medicine anatomy is similar, but they actually a little bit different. So that made a little confusion for our patient. So for example, I have two patients came for back problem. First patient, 25 years old, very healthy young man, just had started doing lifting, heavy lifting and exercise, and he injured his back. Another patient, let's say 65 years old female, and she has ongoing back issues on and off. And this time she tried to lift up her little grandson and her back off. So they both came for back problem. How we treat it? Is the same protocol for back problem? Probably not. Their diagnosis might different, but when you're looking at the Oriental medicine aspect, and first patient we called very acute back problem must be involved in muscle tension, or it can be actually herniation as well, because he was lifting very heavy stuff and then short time period. So impact on that disc might greater than actual the weight he was lifting, and it can definitely damage their integrity of their disc structure. So when we approach, we try to lower the inflammation at the area, because that's what he's suffering now with the pain. And then it can be swollen and hard to bend, and then he probably having hard time bending forward. And but also I'm looking at his other condition, and this young man, he just start working new job and stress level, but I will probably approach more musculoskeletal problem with the acute injury mechanism, more like a sports medicine approach. So treatment involved more pain relief the area, and then I will use the lateral point at the back to invigorate the more circulation of the blood and the nutrient, and then also lowering the inflammation. So second patient, female, age 65, and she had a on and off this back problem. So we called as a chronic back problem. And this time, just a little motion, just bending forward and try to bring this little baby, not that heavy actually, but her back went off. Is it by actual the weight she was lifting? Probably not. And there was an integrity being already compromised long time ago, and it's been suboptimal in my view. So way we approach for this patient, definitely pain relief. And the pain relief point is in the a lot of times in hands and feet, because it has the sensation and the nerve ending at the hands and feet is have a very good stimulation effect for your brain. And then as soon as we stimulate the point and the extremities, your brain recognizes the signal, and then they release the hormone called the endorphin or serotonin to reduce those pain signals she's having it. So my point here, the second patient, her damage might not greater as like a first patient, because it was a chronic, and then it was just a threshold issues. She had it always, and then it didn't reach to that threshold, and suddenly it got up a little, like 1% up. and she's now having problem. So the pain relief will calm down her suffering, and then we try to bring those inflammation as the secondary, because inflammation, she had it already. So the pain is probably more important at this time to calm down, and we try to bring more circulation eventually and help to damage the area to lower those inflammation. So when you're looking at the first patient and second patient, the way we approach is actually reverse, opposite. Because a chronic patient, we acupuncturists love to talk about organ function. And we believe, and then we actually sing all the time, when patient coming with even pain management, if your body is in good health, as proper circulation and then good sleep and good lifestyle, then your body can actually manage. But if you, as soon as you lose that due to long driving to some place, or you had a exposed in really harsh weather, and or even just simply stress from something in relationship, and then whatever the environment, and your overall health is not good enough or not in the optimal, and then that triggers some this pain or inflammation to sustain longer than it is, then is ongoing this tiny stress or trigger actually doesn't help for your healing to be recover fast. So if we improve those along with the actual pain management, and then we notice that your problem actually resolved quickly and then for longer time. So way we improve those general health, we based on organ system we called. In ancient time, the ancient doctors, they didn't have X-ray or MRI, so they looking at the body's function through the pulse diagnosis or tongue diagnosis, or simply hearing what you're saying. And then we categorize those symptoms and we differentiate with the specific name of organ. It might a little confuse you. We said, oh, you have a liver problem. It's not really Western liver you have in here. So then our treatment is based on those the categorized symptoms. We named it with the organ. And so that's, I think, I'm seeing as the most confusion for our patients at this time. And I will, hopefully I can see you in person, explain how we diagnose and approach your care. And I look forward to seeing you in person. And if you have any question after this video, please feel free to email. Our email is info@leeacupuncture.com, and I'm gonna leave that link below here. And also you can call our office 949-723-0054. And I'm Dr. Nam Lee from Lee Acupuncture at the Newport Beach.